Institute of Alternative Medicine System in Bangalore and the founder of Karnataka Acupuncture Association and the chairman of Felicitation of Acupuncture System Therapy Board, Bangalore. I request Dr. Prof.Samiullah sir. So ladies and gentlemen, ഒരു നല്ല കൈയടിയോട് കൂടെ തന്നെ നമുക്ക് അദ്ദേഹത്തെ സ്വാഗതം ചെയ്യാം for the presentation.
Before stepping into my session, I request all of you, please stand for a minute, relax yourself, then certainly we will start the session. Give big applause of the hand. Relax yourself and give big applause round the clock. Increase your energy, increase your chi level. Right. Relax yourself. Go to the topic now. So now has given me is the scientific evidence. This is in fact is not the super simple. It is a very great topic in fact. So try to understand there is something, two concepts I need to present in front of you. That one to be known as a macro acupuncture, the other to be known as the Western acupuncture. Right? How the people will recognize this acupuncture. Do you know anyone how many phonetics in acupuncture? So anyone can give me the answer. Answer is in front of you. How many speaking sounds is there for acupuncture? How to pronounce acupuncture? You just look at the four words. Four words to be known as a acupuncture. Acupuncture. R is the silent. This is the phonetic which already A-K-Y-U-H, P-U-N-K-C-H-U-H is the acupuncture. Acupuncture. So now this is in fact is something is quite interesting, and please move to the next slide. I think if anyone can give me the lighter so that I can use it. Right. So during the nearly 15 years ago, acupuncture has been developed in the majorly in the scientific way. Acupuncture to be known as Eastern medicine and the other Asian medicine, the next to be known as a Western medicine. We try to understand acupuncture is the ocean, not to be studied as only meridians, channels, points is not quite enough. You understand? Now we would like to see the Oriental medicine. In 1979, I believe, the USA has been approved and recognized that acupuncture is the mode of treatment. Whereas in the Eastern medicine, you look at about the Chinese medicine or how he said is the South India acupuncture has been originated. Bodhidharma is taken, migrated, given to the Chinese people. They strongly invented from the 1950s. Acupuncture is the scientifically has been proven. So let me see, this is the acupuncturist is a European physician. In 1680, his name is the Mu Ten Rechi. So he has been invented. So many scholars, so many authors are there, so many inventors are there for acupuncture. But however, it is started thousands of years ago. When the modern medicine started 300 years ago, now they are dominating. Of course, we respect to that system as well. But of course, when there is the system has been developed thousands of years ago, why can't we do that? So certainly this to be as a supreme medicine, then any kind of the medicine, because we respect to other medicines as well. At the same time, nearly 248 countries are existing across the globe. In that globe, nearly 160 countries are practicing acupuncture. Globally, how sir said, 103 countries are having the licensed acupuncturist, of course. We in India, especially Kerala, also required as a licensed acupuncturist in order to practice acupuncture. Next. Yes. The electricity of acupuncture, the feeding of the acupuncture, not only with the manual stimulation, of course this is with electricity having the more vibration in order to get the chi flow properly. We all know chi is the vital force, life force is the key component. We understand about the traditional Chinese medicine based on the perspective of the Zhang Fu theory, Wu Xing 5 elements theory, of course, is the Qi and Su and then essence and body fluids are the key components. But based on that perspective here, the electricity of acupuncture that has been the NIH, National Institute of the Health from the USA, has been approved and recognized this, and the people who are using as only is the manual acupuncture. Of course, is the electricity of acupuncture is most powerful than the manual acupuncture. Please next. So now we look at about when we understand about the modern medicine, anatomy, physiology, pathology, all our biochemic medicine are required, whereas in here what is required is, we called as a Chi, Su, Chinye essence, the TCM physiology, TCM patterns, all are connected to the Zhang Fu theory. When there is the positive and negative, we all know the basic fundamentals. Of course, any diseases, you look at about the medical dictionary, around thousands of diseases are existing in the medical dictionary. But in acupuncture, we don't have any dictionary or the materia medica. We normally treat the people by looking the analysis of the patient based on the perspective of the chi and the blood, and then 5 elements, and then diagnosis. What diagnosis we use? The pulse diagnosis is the pillar of acupuncture. Tongue diagnosis, nose diagnosis, eye diagnosis, right? Scalp diagnosis, nail diagnosis, abdominal diagnosis, foot diagnosis, hand diagnosis, so on. So therefore, all the pathology, the disease patterns can be governed. When we wanted to understand about the pathology, we understand about the acupuncture pathology, not the totally modern pathology. Of course, when we wanted to become the good practitioner, that time you understand the TCM pathology. Of course, is the modern pathology also required. When the patient comes to you, I have the viral positive. Do you know the viral positive is the typhoid positive? All that information also required. This information also required. Next. Then we understand about the acupuncture is the foundation. We all know the marma is the origin. When the marma is started from the Tamil Nadu, of course in the South India. The people are the base through that 108 acupressure points. So we have extracted totally around 822 acupuncture points. Then we understand about the Qing Lu Mai. So this is Qing is the energy, Luo is the connectivity, and Mai is the channel or the pathway. When we understand about the totally, when we know only the 12 meridians, of course this is not quite enough. Totally, how many meridians are existing in acupuncture? 72 total meridians are existing. We try to understand about all the meridians, the routes and pathways and channels and connectivity. It is very much essential. What is the divergent channel? What is the sinus channel? What is the cutaneous channel? What is the Huato channel? All are the key importance, of course. When I'll give you a small example, the large intestine meridian starts from the nail base, ends on the Alanasi, right? The large intestine is there on the lower geo. But how there is the connectivity when apply the LI1, LI2, Shangjan, Erjian, Sanjian, Hogu, Pianli, Wenli, Shosanli, Chuchi. So these are the pin in our Chinese names. So when you apply those points, there is no connectivity to the large intestine, then how you can claim that this will be useful for the large intestine problem? Until you know the divergent meridian, until you know the sinus meridian, then you understand the energy goes and communicating interiorly, because it communicating to the lungs. From the lungs it goes to the intestine. If you know that concept, then you feel proud, yes, this will be helpful for that problem. So therefore it is the interior. When I wanted to come to the Tirur, then I should be the Tirur pathway from the Karnataka, Bangalore. No, I am going towards the Mumbai, going towards the Chennai. I can reach my destination. I should know the pathway from which flight I need to come, which route I need to come and reach the destination. If we don't know the meridian, we don't know the pathways, certainly when you wanted to analyze and understand the patient, when the patient is complaining, I do have the shoulder pain, then shoulder pain is the numerous pains. Patient says, I have the pain only on the shoulder. Your duty to analyze the Shaoyang meridian shoulder pain, Tai-Yang is the shoulder pain, or the Ju-Yin is the shoulder pain, Shao-In is the shoulder pain. Try to analyze how to understand that concept? If you know the pathology of the disease orientation through the connectivity of the meridian and channels, once you understand, that will be amazing so that you can practice abundantly. Of course, here is the ocean of acupuncture you will going to learn. You can see the sinuous meridian and also you can see the divergent meridian. So where is that guy from where this is happening? Next. Now the acupuncture meridians in Beijing, there is a acupuncture meridian center is there where the research center has been done. The meridians are officially existing in our body system. The modern medicine, they cannot understand where is the channels because of course the route of the blood vessels are different from the channels. You remember the channels are not located on the skin surface. The channels are located, of course, on the putial points, on the gingival points, skin surface. When go to the Chuchi, the Chuchi is the L11. The meridian is existing to the deeper level, not the surface level. When the Pinau, large intestine 14, the meridian is existing to the deeper level, not the skin surface level. When you wanted to apply the Yin-Xiang Li20, the meridian is existing on the surface level. So similar way, each and every meridian is it comes like when there is a highway, road. So through that road, the vehicle is not moving like a train. It moves like a up and down. Kerala, you know very well. There's lot of up and downs it is a mountain. So mountain is the amazing I enjoyed by the way I'm coming. So you understand up and downs, the energy also moves in the up and down directions. That has been even all the animals who wanted to become the veterinary acupuncture. We are all treating the human acupuncture, human body. But of course, we wanted to learn the cat acupuncture, donkey acupuncture, horse acupuncture, the elephant acupuncture, sheep acupuncture, cow acupuncture, dog acupuncture, cat acupuncture, so on. When acupuncture meridians, you know very well, the same meridians are existing to the animal as well. When you wanted to perfect as a veterinary acupuncture, of course, even I have the desire. So we will start how the Bachelor of Veterinary Medical Science, a 5 years course is existing. In the similar way in future, inshallah, it will be possible because animals, they don't have the mouth to say the problems. Of course, we will start that is the acupuncture veterinary medical sciences so that we can learn and then teach and then implement to the animals as well. Next, please. So when we understand as the total macro acupuncture point, when we understand the 361 acupuncture points only, we know that. But of course, all the 361 I divided into, because the acupuncture points are located bilaterally, symmetrical way. Now right side also is there, left side also is there. Then totally 3 acupuncture, 309 plus 309, 52 the Renmai and the Dumai, extraordinary points. And also we called as a Huato points. Collectively, totally, body, macro acupuncture. Micro is different, macro is different. If you wanted to become expert in the medicine, acupuncture, the people there are the 400 nearly different types of the acupuncture is existing. My voice is audible, it's not echo. Is it okay? Right, so now you understand we have the 822 body acupuncture point. When we understand about the micro acupuncture, of course greater than 2000 acupuncture points are existing in our body. According to my invention, then you understand each and every pole, each and every hole of the skin also having the acupuncture point where the cosmic energy, we are living in the two ways. One is the heaven energy, the other one is the earth energy. We are in between. So in between, the earth energy is required. In between, there is the heaven energy, cosmic energy also required in order to healthy state. So therefore, when it receives all the energies from the heaven, sky, so that energy is nourishing to all our skin pores. Each and every skin pore, Ayurveda says, 72,000 nadis are existing. In the similar way, each and every part of the skin, the energy receives when your aura is good. when you are healthy, when your thought process is good, your intellectuality is good, your emotions are good, your physical activities are good, your eating habits are good, certainly that aura will become more, then that will be grasping to you in order to feel healthy always. Now we understand, if this is in fact you understand the Huato points, I love these Huato points because you understand when we wanted to practice is the neuro acupuncture. So certainly from the C1 to C1, C2, C3, C4, C5, C6, C7, C8, these are the C8 nerves. You understand it can be treatable for the upper extremities. Any problem on the head region, from the till of the termination of the fingers you wanted to treat for the neuro-related problem. If the medial nerve is affected, the radial nerve is affected, musculocutaneous nerve is affected, pharyngeal nerve is affected on the hand, ulnar nerve is affected, could not able to move the hands. That time it is key information which we need to understand. Treat for the cervical C1 to C8. Be careful because the medulla oblongata is there. We can practice to understand this. One tune deep, you can insert the needle to the Huato Jiaji points on the cervical region to open up all the nerves. So once you do the vibration and stimulation to that points, certainly is the great changes. The needle is inserted. You can't believe it. 10 seconds the patient feels slightly changes. Within 10 seconds the patient feel lot of changes. You understand. This is I have the clinical evidence. Alhamdulillah. But of course this is the key. When we wanted to treat for the sympathetic and parasympathetic nervous system, remember. So now is on the sympathetic, that's called as a cholinergic, the anticholinergic. Acupuncture points is existing. So those points on the Huato Chachi, you remember Chachi means you know that, right? So that points are very imperative to treat for all the neuro-related disorders. Not only neuro, of course it is related to the internal organs as well. That's the reason Panchakarma, they do the stimulation to the spinal nerves. Of course the physical therapies are acupressure to be treatable for the spinal nerves in order to open up the people who are suffering for the sciatica, the people suffering for the lumbar pain, for the cervical brachial syndrome. There is a lot of changes. Next. Now limitation. Only we know acupuncture points around 20, 30, 40, 50. Is it enough? Certainly no. Please study well. All the 361 acupuncture points in 10 seconds, in 10 minutes I told all the pin-in names. No. Changa chena changa shana fiyanga fuyanga konulana pushana shanamai chinamana chingo shugo sotongo chayin. All the Chinese names. Remember each and every Chinese names there is the abbreviation. There is you wanted to know how to understand that. Because acupuncture points is apply here, then that will be the acupuncture point. It's not like that. Of course, try to understand what is the abbreviation of thought. Qian, Yu. Qian means is the shoulder. Yu means is the unity. So therefore, apply the united muscles which we need to treat. See, we do require the evidence. What kind of the evidence? Whether acupuncture channels or meridians are existing, or we wanted to know each and every acupuncture point, done the cross section of the body, right? Cadaver, we know the dead body. Through the dead body, after doing the incision, where exactly the acupuncture point is located. What exactly acupuncture point? I told you 822 acupuncture points, because you know that there is each and every pathway, there is the channel is moving. In that channel, there are the specific places where having the low electrical conductivity, resistance, low electrical resistance and then high electrical conductivity, to be known as a acupuncture point.